Stress, when it's short term, can actually be quite positive and even bolster the immune system. But when it's chronic and when it's perceived as it's not going to change, then it actually can take an extreme toll on the physical body, mental decision making, and then behaviors that could lead to impaired judgment, impulsivity, and all kinds of other hazardous choices. One of the things in terms of viewing the toll that stress takes is sort of hopelessness and our view of the future. And so, if someone isn't able to sort of lean on social support, and if everyone, they believe everyone is sort of viewing them negatively in the long term, that certainly really raises the risk and, can create warning signs if someone's socially isolating and, really changing their behavioral patterns and things like that. That's something we really want to watch out for and make sure someone's plugged into professional help. Some of the cognitive changes that can take place when someone's under a lot of stress that are associated with it can be rumination and obsessive tendencies. So someone certainly could have something going on in their mind again and again. And if hopelessness comes up to where they believe there's nothing that can change what's going on, nothing they can do, then it is possible that in those kinds of cases they might not see the sense in kind of reaching out for support that in fact could be helpful. That's one reason the isolation could come in. The other reason is that sometimes social contact, although ultimately could be supportive, if they believe they're being judged and they have other emotions going on like shame or embarrassment, that also could lead to social isolation. Along with depression, if someone's extremely depressed, sometimes they don't have the energy, in fact, to engage someone socially and get that support.
At the Vatican this morning, Pope Francis asked worshipers to reach out to those in need. It was part of